Yes, good afternoon, ladies and gentlemen. Welcome to another episode of Myth Busting, Myth Crushing. Today we'll be talking about myths regarding cesarean section. I think this topic, it is time to really discuss this topic because it seems people are still not getting it. People still have reservation concerning cesarean section. People still believe that cesarean section is a waste of money. People still believe that cesarean section means a woman is lazy. People still believe that a woman who had cesarean section is not womanly compared to a woman who had vaginal birth or spontaneous vaginal delivery. I don't know why, even in this 21st century, even with our exposure, even with our education, people still have this wicked belief. I call it wicked belief. Cesarean section has been, cesarean section has been practiced since the 16th century. So it's not today they've been doing cesarean section. And surgical experiences and people, with time, cesarean section has evolved. There was a time they were doing transverse incisions. Now nobody does transverse incisions again because research upon research, and they've continued to develop the art of cesarean section for the betterment of man. I don't know, but cesarean section is a surgical procedure whereby a baby is delivered via the abdomen, through a surgical procedure, which is known as cesarean section. We have maternal causes of maternal reasons for cesarean sections, and we have the fetal reasons for cesarean section. For example, when I was still very young, when I just graduated from medical school, I had a patient then. I was working in a private hospital. I had a patient who had eclampsia, severe preeclampsia. She was, she was almost 10. The pregnancy was about 34 thereabout weeks of gestation. And it's so severe that you must deliver this baby expediently. What happened was this. When they brought the woman, we prepared the theater for cesarean because it was an emergency. Prepared the theater for cesarean section. But not just the mother of the woman said no, that they will not allow cesarean section. We pleaded, talked to her, talked to the husband. They've already brainwashed the husband. No cesarean section. At the end of the day, when they saw that we insisted that cesarean section, what did they do? They discharged against medical advice. They went to the general hospital. Of course, you know general hospitals, Nigerian general hospitals, the delays upon the delays. At the end of the day, still, the doctors there, of course, what it is in medicine is what it is in medicine. The doctors say this is cesarean section. There's nothing they can do. They will not allow her to do vaginal delivery. At the end of the day, when they saw that the woman was becoming very weak and very bad, they give in for cesarean section. The woman died. She died right there. But today, that baby should be like 5 years old now. Ignorance about cesarean section. That's one scenario. In fact, if I decided to talk about the scenario that have occurred and we have lost patients because of they are not enlightened about cesarean section, the more you try to make them enlightened, the more you enlighten them about cesarean section, the more they get hungry about cesarean section. This doctor, I think you have connived with this our wife, this one that you want to make money. That is why you insist that in cesarean section. No, we will not do cesarean section. We are going to the pastor for delivery. They will take the woman out of the hospital and take her to prayer house, and she will die right there. Why? Of course, the woman is so weak, probably she may not even be able to sign consent. And yes, this is even the reason why women should be educated. Because a woman that is educated, that is enlightened, will not undergo such mess that the husband or the mother will not be telling her that cesarean section is waste of money. For what? For what? She will tell them to go to hell. She will tell the doctor, give me the form, the informed consent, I will sign. She will sign. She has a right to sign for a cesarean section. She will sign for a cesarean section, and the doctor can go to hell. The husband and whosoever want to deprive her of cesarean section can go to hell. The first thing is informed consent. There must be consent signed that I have agreed for this surgical procedure to be done before the doctor will carry out cesarean section. This is the first step. But most time, this is where we get the problem from. The husband will refuse to sign consent, informed consent for the wife to do cesarean section because he believes that cesarean section is waste of money. Sometimes they even have money, but their cultural belief will make them disagree not to sign cesarean section. Like I know somebody who is a graduate, not just graduate, a postgraduate, a master degree holder, who still believes that only weakling undergoes cesarean section. Not just a postgraduate not just a graduate of postgraduate studies have this low mentality. Cesarean section has come to save the lives of so many women around the world. Cesarean section has come to save the lives of women. Sometimes it is the life of the woman that need to be saved. This is the reason why they need to do cesarean section. Sometimes it is the baby's life that need to be saved. Is the reason why they need to do cesarean section. Sometimes the mother and the baby's life are in jeopardy. And this is the reason why they need to do cesarean section. So denying cesarean section, if it is the risk of the mother is at risk, you deny cesarean section, the mother will die. And this is the reason why sometimes you do cesarean section, it is the mother that will die, the baby will survive. Because the risk, the person that would have been saved for that cesarean section is the mother. Sometimes it is the baby that needs the cesarean section, and you deprive that baby from having a cesarean, the mother from having a cesarean section, the mother will survive, the baby will die. Now imagine a woman carries a baby for a good 9 months, and out of carelessness, out of selfishness, out of ignorance, the baby will die. Whenever people see their baby, they are happy. You don't even know how the baby looks like when the baby is in the womb. I have a friend, when she got pregnant, she came to the hospital. Doctor, I want to abort this pregnancy. I said, never. I don't do abortion. I don't abort babies. Me? No. I sat her down. I talked to her. Eventually, she accepted. She carried this baby to term. The man that got her pregnant was initially irresponsible, but when it was getting close to time for delivery, he became responsible. When she delivered, she looked at her baby, said, God, is this this baby that I wanted to kill? She looked at me and said, Doctor, thank you. Though she delivered she had spontaneous vaginal delivery. And she's very happy. The man is very happy. Whenever they see the baby overwhelming, they have this overwhelming joy. Talk more of someone who is legally married, carry the baby to term, out of ignorance, out of negligence, out of carelessness, the baby dies or the mother dies. Now, what are the maternal indication for cesarean section? 1, if that baby is breached. Normally, some people do ask, doctor, they do ultrasound scan at 18 weeks or sometimes at even 22 weeks, they'll say the baby is breached. Don't worry. The baby may turn. Most times they turn when it is getting to term. But by the time it's getting to term, it is term and the baby is breached, it is an indication for cesarean section. When you tell women, sometimes you tell them that this baby is breached, they have been coming for cesarean section. And when it is almost time, you prepare their mind for cesarean section, they will reject in total. Some of them will say, this doctor don't know what he's doing. How can you say that I'll do cesarean section? Am I the only other women in my family has been delivering through vaginal delivery? Why is it that me will not deliver via cesarean section over my dead body? I will not. She will go, her husband, her mother, her mother-in-law, they will take her to a pastor. They will start their prayers. As if it is not God that has given the doctors the knowledge to be able to tell this woman needs cesarean section. It is not God that has given the doctor this knowledge to be able to make prompt and precise diagnosis. It is the mercy of God. They will go to the hospital and to the prayer house, or they won't go to a traditional birth attendant, and the woman will go there and push a breached baby. You want to push a breached baby? How? Normally, the diameter of the cervix is 9.5 centimeter. Normally, the way the baby will comes out. The diameter 9. If that baby is torn, is breached, is far bigger than where it wants to come out from. It cannot come out. 9.5 centimeter. and you are having something crown rumpling, you are having something more than even 11 centimeter or even 15 centimeter breached, and you want it to come out like that, it's not possible. If you try it, either the woman will have a uterine rupture, she will even before the uterine rupture, she will have obstructed labor. The labor will not proceed. The cervix will not dilate. It will just be there. She will be suffering. The woman will be suffering, losing strength, losing blood, because the baby is breached. The woman will lose blood. The woman will lose strength. And if cesarean section, after she has lost, imagine a woman, how can you allow a woman to labor for 4 days? Wickedness. A woman to labor for 4 days. The duration of labor maybe 6 hours. You give her time to try, yes. But if it is breached, it is diagnosed, this pregnancy is breached, there is no point for you to even give her a trial, to even allow her to push. Elective cesarean section. It is elective. It's not, you will not even call it emergency, because you already know that this woman has an indication for cesarean section. So we call it elective. And that means you have been preparing their mind for cesarean section. But when it is not the D-Day, or after you have prepared their mind for cesarean, you will not even see them. They will not even come for antenatal clinic again. They will go somewhere else. Either they go to a traditional birth attendant to try. When complications set in, guess what? The birth attendant will run down or will call the doctor to help. She will push them out, prescribe one hospital for them to go and try after the woman has labored for days. Now, baby is distressed. Cerebral palsy. The baby will not have what we know as cerebral palsy. When you give birth, the baby brain will not grow. The baby will become a child with special needs because of your carelessness. That is even if you even took a decision later to do a cesarean section to save the life of the woman. But sometimes even the baby dies, the woman dies. Another indication for cesarean section, a woman who has preeclampsia. You deliver this baby in whatever expedient means, the fastest means to deliver this woman. You don't expect a woman who has eclampsia to push. Eclampsia, they've already lost consciousness. You will not allow them to push, for crying out loud. But some wicked people will still say, no, only lazy women undergoes cesarean section. You will not allow this woman to have a cesarean section. Another indication for cesarean section is what? Cephalopelvic disproportion. Probably the woman has a very small pelvis. The pelvis is smaller than 9.5 centimeter. Baby cannot pass through. This is purely indicated for cesarean section. There's nothing you can do about it. Sometimes when you inform them, still, they will go to prayer house and they will die there. Sometimes coexisting fibroid that has blocked the cervical orifice or vagina tumor, vaginal infections. You don't expect a woman who is undergoing some certain infections, the vagina is seriously infected, you will not allow the baby to pass through the vagina. Cesarean section will be indicated. So now all these maternal indications, is it the fault of the woman to have these maternal indications? Is it the fault of the woman to have maternal indications for cesarean section? Is it the fault of the woman to have a smaller pelvis? Is it the fault of the woman to have pelvic disproportion, to have a bigger baby? Is it the fault of the woman to have arrested labor? Is it the fault of the woman to have a very prolonged labor? Is it the fault of the woman to have preeclampsia or eclampsia? Why will you not subject a woman, for crying out loud, what she needs that will save her life? Because of your wickedness, because of your selfishness, because of your ignorance, you will decide her fate. She will die right in the theater, because probably you may eventually sign the consent form late. There's a story of a woman who put her feet on the ground that the daughter-in-law will not do cesarean section. She said never, that the daughter-in-law is wasting the money of her son, that the daughter-in-law will not do a cesarean section. Luckily for the woman, even when she has been discussing elective cesarean section with the husband, she already had a plan B. She already discussed with her own family that this is what she is passing through. In case she falls into labor, she's going to do cesarean section, she may not get support from her husband and from the husband mother. When it was time for her elective cesarean section, she signed the informed consent herself. This is why it is good to educate the girl child. Educate the girl child. If possible, even to PhD level. It is very important for you to educate the girl child so that all these wicked husbands and wicked mother-in-laws will not subject them to maltreatment. She signed her informed consent. Why the husband is thinking that since the woman decided to do a cesarean section herself, let her, they will abandon the woman in the hospital. Unknowingly to them, the father of the girl has already paid for the surgery. And the cesarean section was done, and the cesarean section was successful. They were put to shame, big shame. Big shame. Now, what now happened? You see, sometimes you cannot predict the future. This same woman, after years, the own daughter got married, and she had maternal indication for cesarean section. The mother was the one running around for the daughter to have a successful cesarean section. And the wife of the son that she deprived of cesarean section, that one was just laughing. You deprived me of cesarean section. Now your own daughter want to give birth and she has indication for cesarean section. You are running scatter to make sure the cesarean section is successful. Why did you not take her to prayer house or traditional birth attendant that she must push? If not, that you are wicked. If not, that you are wicked. What kind of a culture is this? Okay, now there are indications for cesarean section, fetal indication for cesarean section. One, cephalopelvic disproportion, when the baby is overly enlarged. it is in the cesarean section is indicated. When this baby is distressed, cesarean section is indicated. When placenta previa is placenta previa is diagnosed, it is an indication for cesarean section. What is placenta previa? We have abrosial placentae. The placenta is coming before the baby. If you try vaginal delivery, that baby will die. That baby will die. Classical cesarean section. Last year, a friend of mine was wailing on Facebook. I said, "What is the problem?" He said she lost a friend. Why? What happened? He said initially there was an indication for cesarean section. The family refused that prayer will solve the problem. When prayer was not solving the problem, at the dying minute, the cesarean section was indicated. At the dying minute, when the woman is tired, she has lost blood, cesarean section. Okay, doctor, let's do cesarean section. What? At this dying time? What the doctor will do? At least it can be medical legal issue. He of course carried out the cesarean section. The woman died. The baby died. Are these not preventable deaths? Though they will tell us it is destiny, qadar, but I think some deaths are preventable sometimes. Our actions sometimes need to be checked. The baby died, the mother died, and the husband was crazy. He was crying. He has lost a beautiful wife. He has lost a beautiful child, a woman that has been with you. Imagine the trauma he will pass through. Someone that has been your companion for years. You lost her just because of little selfishness. What the pastor have told him that if they allowed the woman to do cesarean section, the woman would die. And the stupid pastor, after he has deceived them, after the woman is dead and the baby is dead, he now came back and started telling them that you see, if you are not done cesarean section, she wouldn't have died. A woman that would have even died, that it is because of the delay that even made her to die. The pastor now want to put the blame on the cesarean section. Now, sometimes there are some cesarean sections that are not necessary. For example, a baby that is dead in the womb. Why will you want to do a cesarean section? Why will you want to subject the woman to cesarean section under the knife when the baby in the utero is dead? Except there are indications that will kill the woman, then fine. But there are other patterns that you can do. We call them destructive surgeries. Though people frown at it, maybe that's why they will allow the woman to go into cesarean section. Cesarean section is very important in obstetric practice. You cannot take it off the table. Cesarean section has reduced maternal mortality rates drastically all over the world. United States, Canada, think of all over the world. Cesarean section has reduced maternal mortality rate drastically. Though there are other reasons why we still have increased maternal mortality rates in Nigeria. But at least cesarean section has solved a number of maternal mortality rates. Now, some people, after cesarean section is done, they will start misbehaving. The prescription from the doctor, the mother-in-law will reject. Prescription from the doctor, father-in-law will reject. Prescription from the doctor, they will all reject. You have done surgery for this woman. Don't give her anything orally. They will not listen. Some will not listen. Pepper soup, pepper soup, pepper soup. I don't know where they got this thing from, that when they drink hot pepper soup, it will wash off all the blood from them. I don't know where they get this from. A woman that just had surgery, that has not even come out from anesthetic effects, you want to give her pepper soup to drink. You want to force food into her mouth. You want to kill her. Bowel sounds, the doctor have not given you go ahead. He has not had any. The intestines, they are atonic. The intestines are not moving. They cannot absorb anything. Probably because of the surgery, you have touched the intestines. They cannot absorb anything. You want to force her. At that time of you forcing her, you will force that pepper soup into her lungs, and what? She will drown in her own fluid. She will die right in your very before eyes. It's not magical. In your very before, she will cough and cough and cough, and the doctor cannot do anything to save her right there, except they take her to intensive care units. And most times, all these are hospitals, general hospitals, private hospitals, we don't have intensive care units. She will die right in your very before, because you have decided to force her to take pepper soup. She will aspirate. They will prescribe antibiotics for this woman. Mama will say they must open the wound. She want to press the wound. She want to press belle. That culturally, when a woman delivers, they will be pressing the abdomen. Doctor will warn her, Mama, don't do it. Oh. Doctor, I hear. When doctor has left, they will open the wound and Mama will be pressing. They will introduce infections. What happened? Wound breakdown. Wound breakdown, sepsis. Surgery successful. Baby hale and healthy. But because of culture that in fact, they will introduce infection to the wound. They will break down the wound. Then you are no longer a woman that maybe within 5 days of after cesarean section you will discharge her. Now wound breakdown, you start treating wound again. Sometimes the wound will open totally. Another serious problem. Carelessness. Because of they will not listen. What they want to do is what they want to do. After all, they've been doing these practices for the past hundreds of years. They don't know that this practice they've been doing for hundreds of years, they just escape by whiskers. By the whiskers, they escape. By the whiskers, they escape. Now, she is recuperating. She is hale and healthy. Now it is time to breastfeed the child. They will start arguing again. Give this child water. Give this child water. Why must you be punishing this child? No matter how much you try to explain to them the importance of exclusive breastfeeding, the importance of this baby to take colostrum, the first milk from this mother, they will in fact argue with you. I used to say colostrum is the first immunization you give to a child. The yellowish breast milk that comes out as when you give birth to a child, before normal white milk start coming out. Very, very important. It contains a lot of immunoglobulins that will help this child grow. They will continue to help this child for till old age. But mama will be looking for SMA gold and NAN. If the woman is not expressing milk, we understand. But not that this woman is expressing milk, a lot of milk. You said you must give this baby food. What happens to the milk? Milk does not get finished. The more the baby sucks, the more the milk reflex, we call it leg down reflex. The more it is firing, the more you are producing, the more you give baby suck, the more you are producing milk. That is how God, in fact, God designed that reflexes to perfection. Not a single mistake is left, to perfection. So you give the baby breast milk, allow the baby to be with the mother all the time, let the baby have warmth from the mother's skin, baby will be doing fine. Mother will be recuperating fine. Happiness will make the woman heal more. The more she will make her happy, the more she heal fast. Now, this is part 1 of misconception of cesarean section. Now, misconception about baby now. Baby has come. You have welcomed baby. Everybody is happy. People now believe breastfeeding is scam. Why are you not breastfeeding your child? I don't want my breast to fall. Breast that will fall. Gravity will make it fall. Take it or leave it. As a woman grows, her breast will definitely become flabby. You breastfeed, you don't breastfeed. If you think I'm lying, ask these women who got married late, who has never had a child. If you think I'm telling lies, ask them. They can explain to you. Breastfeed this baby? No. This baby will benefit from breastfeeding? No, I don't want my breast to fall. I don't want my breast to be flabby. I don't want my breast to be sag, to sag. Who told you that your breast will not sag? For crying out loud. It's just buying time. It will sag. You breastfeed though, you don't breastfeed though, your baby, your breast will sag. Another misconception. They feel that the breast milk is not enough for this child. The breast contains enough calories, enough protein, whatever that baby needs for the day. In fact, the way the breast milk tastes this morning in that baby's mouth is not the same way that breast milk will taste in that baby's mouth in the evening. The breast milk, the miracle of breast milk is it is tailored. The body tailors it according to the need of the baby. According to the need of the baby. Now, you refuse this baby breast milk. You have denied him something that will benefit you, and it will cost you more. One, breast milk is free. Breast milk is free. You are not paying for it. But Nan is not free. The more you give nan, your baby will become obese. Your baby becomes obese. Your baby becomes obese. Your baby is prone to diarrhea. Your baby, you use enough pampers, diapers that is expensive. Imagine you, diaper that is 5,200 because you are giving your baby nan and baby food. Your baby will be passing enough stools. You might be using up to 3-4 diapers a day. Meanwhile, if you are doing exclusive breastfeeding, your baby even hardly pass stool. What he will be passing is urine. So let us know that there are other misconceptions. I'm going to stop here. I'll continue next session. We should know that one, there are maternal indication for cesarean section. There are fetal indication for cesarean section. There are indication for both maternal and baby fetal indication for cesarean section. If a woman needs cesarean section, don't ever deny her cesarean section, except you don't love your wife. A man that truly loves his wife will not even listen to the pastor, will not even listen to the mother, will not listen to anybody as far as the doctor have advised them. The woman has been going to antenatal. Lest I forget, some women think they are so wise, they know it all. Because they've given birth to first baby, second baby, they will go and register antenatal a day to when they will deliver. It's not good. Even though you are experienced, it's not good. It's dangerous. Lest I forget also, another indication for cesarean section is cesarean section. If a woman has undergone cesarean section the first time, there is room for vaginal birth after cesarean section. The doctor will give her a trial. But if indication for a cesarean section happens in a second time she undergoes cesarean section, then she will always undergo cesarean section. And it is risky after she has gotten 3 to 4 pregnancy under the scar, under the knife for 4 times, 4 surgeries. You don't want her to rest. You don't want her to do family planning, because family planning is haram. You want to kill her. Meanwhile, if you have appendix, let's say you have appendicitis, let's assume appendix regenerates, it grows back if you remove it. Let's assume your appendix that they remove grows after every 9 months. And the doctor said you must be doing appendectomy every 9 months. Even you, the man, you cannot stand it. You do 4 appendicectomy. You can't stand it. Talk more of a woman who is undergoing a major surgery, cesarean section, 4 times. If not for the love of children, I don't think any woman after a first cesarean section she even want to deliver again. I don't think so. If not for the love of children. You do first cesarean section, scar. You do second, scar. You do third. Why don't you do family planning and let this woman rest? But no, you want to continue. And sometimes they do first cesarean section. Oh, this is waste of money. They do second cesarean section. This woman want to kill me. What kind of a woman bad luck is this? You impregnate her again, 3rd cesarean section. This woman will kill me. You manage to do the cesarean section. The 4th one, you run away. You say, no. This one, you will not do cesarean section. You are going to push as other women push. You force this woman to go and push. One thing is sure. There is no doubt. Our uterus will rupture. She will have a ruptured uterus. She will bleed to death. It's sure, banker. It will happen. Maybe we may say, okay, it's second pregnancy. It may not happen. But the risk is there. but third, fourth, it will happen. There's no two ways about it. So let's stay safe. Let us know that cesarean section, a woman that undergoes cesarean section is a woman. A woman that undergoes spontaneous vaginal delivery is womanly too. The end product is safe delivery, which is what everybody clamors for. A woman that will undergo cesarean section, at most at 34 weeks of gestation, it is already established. In fact, if you impregnate your wife, you know that your wife tells you, I have missed my period, I'm pregnant. You have good 9 months to prepare the arrival of your baby. Even though you receive let's say 2,000 naira a day or 1,000 naira a day, for 9 months, even though you are keeping 500 naira a day every day for the next 9 months, I'm telling you, you can solve a problem. The assistance you will need will just be infinitesimal. Depends on the outcome, will be infinitesimal. So let us stay safe. Let us know that cesarean section is not a death sentence. Cesarean section is not a problem. Cesarean section is not an abomination as people are taking it. Let us, a mother-in-law that is forcing a woman that has indication for cesarean section, is forcing her not to have it. You people should speak out. If your mother-in-law is forcing you that you must not have cesarean section, speak out. If your husband is forcing you that you must not have cesarean section, madam, speak out. Speak out. Anything that will lead to maternal mortality is frowned out. There are NGOs that will take it up. Speak out. Don't keep quiet. If your husband said no cesarean section, you have discussed with him, no cesarean section, start talking to people. Start preparing your mind that your husband will abandon you. We have so many useless men called husbands today. So many useless men. They are very useless. Very, very useless. Forget, they think that phallus is what makes a man. Very useless men. Thank you so much for listening. Till we meet in our next episode, Busting the Myth. Thank you. Bye-bye.